Okay, sorry, I did not go. Apparently I needed to hit OK on that. I'm in now. I don't know why this is the most confusing darn thing. Sorry about that. I looked like I was waiting for the meeting to start, and then I figured it out. I apologize. Can you hear me? It's John.
Not a problem.
Good to see you, John.
Yeah,
Okay.
When you're ready, Committee Chair Chalmanak, feel free to call the meeting to order. I am monitoring the attendees to see if there's any other implementation board members.
Okay.
Are.
Okay, and let me just see how many IB board members do we have? I know looks like at least 4. I'm not seeing all of the names, I think. So I see at least 4 members, including myself. Okay, well, let's get started then.
And we are live.
Okay, good afternoon. It is Thursday, May the 4th. This is the regular meeting of the Implementation Board System Planning Committee. I apologize for the delay. It was, as they say, an end user interface problem on the part of the chairman. Didn't quite get to the meeting on time. My apologies. We do have an agenda before us today. Let's start first of all with a roll call of those members who are present, and then we'll acknowledge if other members of the IB board join us. Who is going to lead us in that? Alexis, are you going to do that, or Austin, are you going to do the roll call?
I'm happy to lead
That'd
us
be
through
super.
that. Wonderful. Board member Ready?
Present.
Board member Carvalho?
Here.
Board member Merritts?
Here, and I apologize. I'll have to leave 15 minutes early today.
Thank you for letting us know. And board member Chalmanak.
And I am here. We will start the meeting as we always do with a land acknowledgement. It is a tradition here and that we do this. And we acknowledge that King County is located on the unceded traditional land of the Coast Salish peoples. We honor this land and its people past and present. And we are committed to directing funding and resources to organizations led by and in support of Native and Indigenous peoples. With that, let's move to begin the agenda, and we're going to be going over parts of the 5-year plan as they were released. I'm going to turn it back over to, first of all, I'll just ask any board members, do you have anything? And I see that board member Juanita Spotted Elk has joined us. Board members, do you have any questions for what we're doing today, just before we launch into this? I am seeing none, so I'm going to turn this over to Alexis and let us get going. And we would like to be done by 5 o'clock today and get through a lot of fairly dense material. So I'll turn it over to you.
Wonderful. Thank you so much. And so by way of a review of our materials for today, I've put the link to the System Planning Committee meeting in the chat for all including panelists and attendees to see. These materials were posted last Friday. Our agenda for today, first starting with a pickup on reviewing the years 1 to 2 table. We'll then go through that hopefully and complete that section by 3:45. We'll spend 15 minutes starting the years 3 to 5 table, and then from 4 to 4:30 we will be visited by the Chief Community Impact Officer Owen Kafitz to revisit the metrics and measurement piece that we discussed last week. I know this group had some questions and feedback about those pieces, and so having Owen in the space to better speak to those pieces, as his division is a part of and will be doing the measurement related to the 5-year plan moving forward. And then we'll spend the last part of the meeting doing the final review of years 3 to 5 table, with hope to, of course, carve out time for any closing next steps and directed questions. The only other thing I have by way of updates from staff, and I would invite some of the other staff on the line to chime in with any updates they may have. I wanted to voice that as a part of your meeting for next week of the full implementation board. Staff are preparing a brief memo for the full implementation board, and that memo will include a quick summation of some of the key policy considerations and proposed changes to the 5-year plan. So it's to go before the full board for discussion as well. So formal subcommittee report out and write-up of feedback from and work of this subcommittee will be included in your meeting packet for the full board. I want to invite my colleagues. I know we have a few other KCRHA staff on the line. Austin, any clerk updates? Nigel, anything you want to chime in on from the perspective of governing committee?
No real clerk updates. The only thing I would say is that there will be a revised agenda coming soon along with the memo. So Simha, the timing is perfect. And we will make sure that is sent to you your way and update on the website.
And I don't have anything to add right now. Sorry.
Not a problem. And with that, that concludes staff update. Any questions on the staff update before going into material for today?
I'm not seeing any, so let's move into the material. Thanks.
Wonderful.
Oh, sorry, John. Can I just ask a quick thing?
Okay.
So
Yes, quick. Go ahead, Ben.
is the plan to have Alexis just kind of read through the materials first, or would it be safe to assume that we've all read them and could just go straight into discussion? I'm just sensitive to
Well, I mean, this is also this is a meeting for the board, but it is also a public meeting. So I do want to see us go. I don't know that read each element is the right way to put it, but to walk through the elements quickly and then open the floor for questions and comments from the board, so that so for example, on this first section, that we get through that questions and comments by 3:45, and that would be on years 1 and 2. If you're looking at the agenda. Okay, does that help?
Yep. Thank you.
Perfect. Okay, let's go. And let's definitely keep in mind that timing.
Absolutely. Thank you so much. And so I will try not to talk your ear off either, but absolutely want to make sure that we're reviewing this content for the purposes of the public that may be listening in. We are starting at years 1 and 2 table. So this is starting from page 26, but really page 1 of the material packet that was posted. This is a table that was developed to really take into account, and you'll see the sentence at the top of this page really indicates that these are a series of actions that have been not only proposed throughout our community engagement process and really identified as key actions that need to be taken up across the 5 years, but also under the consideration of our current budget. And so within years 1 to 2, I'm going to very quickly breeze through some of the things that have been raised and are included on this table. So key actions including things such as, taking us to, I'm going to do a quick walkthrough of how we've structured each of these items, so each of the columns, and then I'll do a more breezy overview of the content that's included here. So starting at the top, we have for years 1 and 2, we have enumerated these as 1-2A. And so this whole table includes this prefix 1-2 and then is sequenced by letter. So 1-2A has the key action, develop a real-time bed availability tool inclusive of all types of shelter and emergency housing. We've tagged this key action with the topic areas, data, and resource availability. And then we've written an impact statement, which is currently reads as insight into real-time shelter vacancies will allow for greater enrollments into the shelter system at any given time, which will improve our understanding of how many single adults, families, and youth may be accessing the system. For the years 1 and 2 table, we've included this additional column, which says status, as a number of things that have been listed here have been already underway, things that KCRHA has strongly identified and been encouraged by community partners to get rolling on. And this is something that has been already in progress and has an associated work plan with it. And so the last thing I'll note before doing a more light overview of the other areas is that each of these impact statements is intended to tie back to the high level metrics that we talked about last week, and we'll be talking about again at 4 o'clock when Owen joins us. But you'll see the bolded section of the impact statement is meant to be that part that ties back to the overall system performance and metrics that we are including in the plan. And so with that, I'm going to now guide us through the rest of the activity. So I'll just be reading the key actions as opposed to doing the full read through of every column, and hoping that we can go through at least years 1 and 2, and then pause and have the board weigh in with questions and feedback on that section. And then we'll go through the same exercise for the 3 to 5 table. And so taking us to 1-2B, this is partner with behavioral health organizations to support connections to behavioral health services. 1-2C is partner with King County Behavioral Health Recovery Division and Public Health and Healthcare for the Homeless Network to improve communication, coordination, education, and information sharing across our homelessness response system for high acuity individuals. 1-2D is in partnership with local jurisdictions, provide expertise and support in an effort to increase temporary housing, sheltering, homelessness services while maintaining current level of services in every subregion. 1-2E is coordinate with faith-based communities to identify untapped physical spaces to be used in severe weather shelters. 1-2F is identify and evaluate spaces for severe weather with cities to expand indoor options during severe weather events. 1-2G is deploy coordinated severe weather response that incorporates innovative practices in response to immediate needs. 1-2H is expand severe weather contracts to be appropriately staffed during severe weather events and including evening support. 1-2I is incorporate allowances for severe weather shelter response in existing contracts to support standardization of severe weather response. 1-2J is improve guest connection to services beyond the severe weather event. 1-2K is to align with city's comprehensive planning efforts for future development of temporary and permanent housing options. 1-2L is improve coordination between domestic violence and gender-based violence services to support families and individuals. 1-2M is enhance therapeutic support at existing programs for high acuity clients. 1-2N is to resource outreach services with appropriate staffing and pathways to housing options. 1-2O is increase capacity building support to buy-in for agencies that are staffed by and serving disproportionately impacted communities in order to expand their entrance into or expand their work into homelessness service work. And so I do want to take a pause on this one to provide an additional explainer here. You will see on the far right, this is marked as in motion, but we have an additional explainer here talking about how this work has begun, but really only in a limited capacity. This work has primarily been done through our community capacity team working with some of these organizations. And so primarily the expenditure here is around staff time, staff working with some of these smaller organizations through the RSFQ process. And so we wanted to make a note here that this can only be done in a limited capacity without additional funding. So wanted to clarify that point before moving forward. And then 1-2P is regularly evaluate our level of funding and percentage of the investment into programs and organizations and programs designed to support the needs of Black, Native, LGBTQIA2 spirit, immigrant, refugee, people living with disabilities, and people exiting incarceration. And then 1.2Q is expand administrative capacity to support the development of population-specific procurement, particularly focused on emergency housing options for trans and gender nonconforming individuals. And then 1.2R, develop funding opportunities for by and for organizations to expand culturally relevant approaches. 1.2S, expand outreach tailored to families experiencing homelessness. 1.2T, develop and implement a grievance process that is accessible, safe, and responsive to resolve client or funded partner concerns, problems, and complaints. And I will pause here as I see a hand from Board Member Carvalho.
I was just wondering, since session just ended, as like we're going through this process, are you all flagging like, so the 1-2 year plan is like, and even the plan after that is under the assumption that there's no more, that there won't be increase in funding. But I know that Washington just passed like a lot of like protections for gender affirming care. And so I'm just wondering, like, since session just ended, are you all like keeping that in mind as like potential, like, oh, this could be a potential for like state funding or something along those lines?
I would invite that's a fantastic question. Thank you for that. And I'd invite our intergovernmental affairs manager if he has something to share on that. But that's something that I know we're going to be looking at further, the outcomes of state leg session and seeing how we can match up and pair efforts, especially with specifically trans and gender nonconforming care. There's some identification when we've done the full review of the landscape of services that we do not have any programs that are specific for serving this subpopulation. So it's been identified really to be data-driven, looking at how we can be able to procure and secure a specific type of program that serves the needs of these folks. But Nigel, is there anything you want to add on how we're layering in and building on the outcomes of the state legislative session?
I think that's got to be more of kind of a rolling thing that we do after every session. I can't think of anything from this last session that folds into the discussion right now, or at least anything that we were tracking. Yeah, I'm sorry I don't have a better answer right now, but I think that's something we're going to have to evaluate on a rolling basis going forward once this is approved.
Thank you for that, Nigel.
Alexis, did you want to read through every one of them before receiving feedback or questions, or it may take a little while?
It may take a little while. Since we're already paused, I'm happy to continue the pause here if folks have feedback thus far.
Gotcha.
So Simha, do you have some feedback?
I had two questions. The first, with regards to the series of initiatives around severe weather shelter, this is again based off of our current funding model. If our funding expands and we're able to transition to seasonal weather, these same our expectation is that these same initiatives will transition over to that seasonal weather approach. Okay. We're just not calling out seasonal weather because we can't make that happen this year. Okay.
We think there's some improvements that we could make around like the coordination and like pivoting like funding within contracts to be more specifically used for severe weather response. But the real pivot to expand to having more days available and having that seasonal weather response is something that we've identified. We just need more funding to be able to implement.
Gotcha. Thank you. And the second question, I apologize. I'm having trouble recalling for if it's in 3 to 5, but we talked about connection to behavioral health and then sort of healthcare for the homeless, but didn't specify sort of improving sort of connection to Harborview or sort of medical systems, I guess, separate from behavioral health. And if that was intended to be in this first couple of years or later further down the road.
A great note on this one. I will need to take that back to the team. I know Sparrow's not on the line today and she was a part of drafting that language specifically. I think the spirit of this was around, again, the high acuity folks, and honestly, not naming of healthcare partners just might be a miss on our part, but we'll definitely take that feedback back. I'm hearing from you wanting to be able to name explicitly healthcare system is what you'd like to see.
The thing I'm thinking of is to be able to offer, to provide that sort of continuity of care for people discharging from medical respite, from, Harborview, from, whatever hospitals we're referring to. having some sort of resource pathway.
Great,
And even
thank
if we can't create a resource for it, like just having the connection point, I think is I'd love to have called out. Thanks, Alexis.
Anybody else have a quick question here, or can we keep rolling on?
Can I just say,
Paula?
I don't know how useful I think it is to read through each one. I don't know if that's just me, but yeah, I feel like I feel like I would get more out of if we could ask like very specific questions instead of going like piece by piece.
So if you have a specific question on what's been covered so far, I would say this is a great time to answer it. We're sort of balancing two things. People who have read this material and want to get into the depth of it, and the public who probably has not done this. So public meetings serve both of those purposes. And sometimes they can be, that can seem as if it's slowed down, but it actually does bring the public along so that there is understanding. I would say just simply reading, I think we're going to get into this better when we get to the, at least I hope, in terms of the metrics that are going to be used. That's just sort of my hope on this. So if there's a, Paula, if there is something specific to what we've covered so far, let's do that. If not, let's push on with the presentation. And if you come up with something that you really want to delve into, let's do that. Do you have anything from what's come so far?
No, I don't. Yeah, I guess my question is, I understand the point, and that this is like a public meeting, but the public doesn't have the ability to ask questions. So I'm unsure like what is, and this document is public, right? Like people have this. So I mean, I'm all for it. If you all like it, I love it. I personally am like, I don't know what it does to go through each one if like the general public can't have the ability to ask the questions that they have. But Chair, I leave it up to you. I'm totally fine. And I will raise my hand when I have questions.
Okay, excellent. I think that we should proceed. I think we don't want to bore people with reading each and every one, but I think this gives a breadth of what the agency is doing. And it is very broad, and these are things that we are doing in years 1 and 2. So let's keep pushing, and anytime anyone has a question from the board, let's jump in.
Sounds good. Thank you all. And I see there's a hand from Juanita, board member Spotted Elk.
Juanita, go ahead, please.
Hi, I'm looking at the draft right now, and I just had some questions about the ombudsman part. Are we on that part yet?
Great question. We are just starting the initiatives on the Ombuds office.
Okay, I'll just wait. Thank you.
Thank you.
Great,
And
thank you.
it's definitely appreciate it. I will try my best not to be boring, and thank you everybody for your patience. I can spruce it up. So with that, some of our initiatives related to the Ombuds office include deploying an effective communication strategy to ensure that the Ombuds office is well known and easily accessible, including the creation of centralized contact mechanisms, for example, a hotline. We also have having the Ombuds office provide regular reports to the implementation board on grievances filed and resolved by the Ombuds office, including relevant demographic trends and reports being filed. We also have standing up of an Ombuds advisory board, and then having continued so those are our Ombuds ones. I'll actually pause there. Board member Spotted, you mentioned you have some feedback on these.
Yeah, I'd just like to find out more about this advisory board. How many seats and who will be on this board?
That's a great
Or I
question.
see it still in progress.
Yeah, the design of this is still in progress. I know our chief ombudsperson, Katara Jordan, has been just starting the process, and she and her team had identified that this is something they wanted to do, but more detail to come. Don't have any details to share today.
Okay, I just like to, it would be good to have people with lived experience on that advisory board.
Perfect. Yes, absolutely received. And I know that's her intent as well with that, but we'll definitely carry that forward and ensure that that's something that is included as it's aligned with our theory of change.
Can I ask on that question? What is the purview, not the purpose, but the purview of this advisory board for the Ombuds office?
Perfect question. So I'm going to also link information for the public about the Ombuds office. And so our Ombuds office is intended to, is dedicated to improving our quality of services for folks experiencing homelessness around the county. And with that, people are encouraged and invited to be able to file grievances if they experience any type of mistreatment. There, people that are served by the Ombuds office include community members that are using services that are overseen or funded by KCRHA, as well as employees, funders, and contractors of KCRHA, and providers who implement services overseen or funded by KCRHA. And they're primarily responsible for inquiries, concerns, and complaints. So in the conversation with our partners over at the Ombuds office, they've identified wanting to stand up an advisory board to have an additional vetting mechanism as they are accountable to people who are filing grievances, wanting to ensure that some of these actions that have been identified here in terms of how communications are going out from the office and how grievances are filed and how the grievance process is for somebody who is going along the grievance process, wanting to have a body to be able to vet ideas from. That's not necessarily KCRHA staff, but rather a body of folks that would be utilizing the Ombuds office.
And
Thank you.
just to add to it, I used that service and it was really helpful in my circumstances. And it was like a mediation, and it helped resolve it. And it actually, if it wasn't for the office, I don't think I got my emergency vouchers. Yeah, because they got lost. But yeah, it took a whole year.
Okay, great. Thank you. Any other questions on this topic? I'm not seeing any right now, so let's move on.
Moving us into some of the initiatives related to coordinated entry, we have continuing improving coordinated entry mechanisms based on sub-regional information, as well as information from the Homelessness Management Information System, as well as with feedback from people with lived experience. Developing administrative capacity to support the advisory committee. The KCRHA advisory committee plays a role in overseeing functions of coordinated entry, and then reviewing and modifying the design of regional access points programs to improve folks' experiences with it and access to housing.
Can I ask a question about that? Is this regional access point, is this like a 211? Is it like revamping 211, or is it like the kind of what do they call it, how Marcus talked about, like kind of the my charts where people can interact with their information and their data? Can you just explain what this regional access point is?
Absolutely. So regional access points, and I'm going to also link some information in the chat for folks who want to learn more about coordinated entry. Here we go.
Oh, it's coordinated entry. Okay, never mind.
Yes, it's a space where, so we have these spaces where essentially folks can come in and be able to receive an assessment. And so it's really tied to that. And what you're speaking to, though, Board Member Carvalho, is this piece around our higher level like data systems kind of revamp and moving towards a by name list. So ideally a regional access point in the future would be beyond just getting somebody a coordinated entry assessment, but getting them in kind of a by name list sort of framework, which would then also support in their housing placement.
Gotcha. Thank you.
Thank you. And so taking us to double A, we have established an equitable procurement process, implementing a phased portfolio reprocurement process, ensuring geographic coverage and service continuity with housing focused resources.
May I make
Yes,
a
Ben.
comment? So I apologize. I forgot this is a 2-hour meeting. So I said I had to leave 15 minutes early. I actually meant an hour and 15 minutes early. So I'm going to get on a plane, so it'll get noisy. So I just wanted to make one specific point now, if that's okay, about these 1-year plans.
Go ahead. Yeah, go ahead.
So I think these are all really great ideas in here. I think everything is definitely worthy, and these are all things that should be done. But my concern is that when I look at these in aggregate, I don't see a specific plan to reduce the number of people who are unsheltered. You know, for example, I understand that we don't have any places for unsheltered people to go at this time. And so I would expect there to be a major element to adding more shelters, which doesn't appear to be here. And there also doesn't appear to be any other specific things that we could point at and say, that's how we're going to get from X to Y unsheltered and make progress in the first year against our stated objective of ending unsheltered homelessness. So and that's not a criticism of anything that's on here. These are all really good ideas. I just feel that we have a lot of trees and no forest, or perhaps all forest and no trees. I think we need to try and create some greater specificity around how we are actually going to make progress, not just in the next year or two, but really tomorrow, because we know there are thousands of people who are unsheltered who really need to be brought inside or face dire circumstances. So I applaud these ideas. They're good ideas. I'd like to see perhaps more specificity around our objective, and perhaps some of these ideas may not rise to the level of the 5-year plan. They might just be things that the authority does, you know, on its own as part of its general operating plan. But what I think we do need to have in here is specific initiatives that are going to directly lead to unsheltered homelessness declining.
And I think, and Simha has his hand up, but I think it actually, it goes to a part of what is the job of the KCRHA, and is it the KCRHA that will be going out and figuring out a way to get more shelter, specifically by KCRHA funding it through our funders, or is it the people who have the money for shelter to create shelter going out and doing it, and the KCRHA helping to utilize that shelter? And I think it's a little bit of both, but I'll stop there and I'll add Simha to his comment here. His hand is up.
Thanks, John, and thanks, Ben. I think this idea of like always bring it back to the mission, right, makes sense. Which is actually, you know, when I look at the third column, what I have appreciated about the approach that you've taken is that you include things like increase exits to permanent housing, improve throughput, reduce returns to homelessness, right? Like this is all about efficiency of the system. Like every one of those things speaks to, even if it's sometimes a little hard to put quite a number on it, right? Like this will improve efficiency by 3%. But that's what this is. This is improving throughput and efficiency, getting people housed, right? Like in Juanita's example, right? Like an ombuds office isn't just like a moral necessity, right? Like to have a voice for people, it's because it makes things work better. You hear people's concerns, you go and get them fixed, and then hopefully improve the system. So it's not always about just adding more physical beds. It's about improving the efficiency of the beds we have now. So with more effective beds, I guess. And maybe I want, you know, I don't know how we can sort of pull those out, right? Like here are the tags that actually we think most directly focus on efficiency. There may be others that focus on that expansion, you know, when we get more funding or whatever it may be. But that was sort of my response to that. I do think drawing back to the mission is important, and finding a way to sort of connect that efficiency piece to that is make it more explicit, I think is helpful.
Paula or Juanita, do you have any comments here? No, okay. Juanita, I'm seeing Paula shake her head no, but do you have any?
I'm actually curious, Ben, I'm curious your thoughts on that sort of response, like this sort of idea of efficiency mattering and initiatives focused on efficiency.
Thanks, Simha. Efficiency definitely does matter, but my concern is that really we could do all of these things and still not make a dent on sheltered homelessness, because without more places for people to go, there will not be anywhere for people to go. So these seem like all worthy initiatives that we should be doing, but I just don't see any of these making a direct impact on the one metric that really matters for us.
I did want to give Juanita a chance to weigh in. I see her, she came online here with her picture, and then we can circle back on this if she has a comment.
I think those are good questions that Benjamin is raising, and to always want to be more effective. And I think Paula also raised, making sure we're engaged with the community and the public and answering their questions and being transparent. And also getting, I think, the work that was done in collecting, I think that always has to be ongoing. It's just not a one-time thing, right? Because if you're doing an analysis of what is needed, and it takes everyone collectively in our community and being all addressing the needs of the people, being able to save lives and put people in safe places, whether it's detox, hospital care, inpatient care, especially for psychiatric, and I believe the mental health is really, there's such a high need for it. I was on the bus the other day and it just breaks my heart. A young man was, I don't know, he was under the influence of something, but I don't know if he was developmentally disabled, but he was having a hard time. And I was looking around and it seemed like nobody cared. And I told the driver that his passenger needs help. And it looked like he was mentally, like he was just not stable, and just having a breakdown. And I think that crisis is now in being able to have interventions, right? In medical care, there's interventions. So I think social justice, we need interventions now, whether it's tiny houses, whatever types of emergency, and just pursuing all input from everyone, and with all the funding, et cetera. I think these are, you call them initiatives, and being able to, there should be an advisory board too. The Ombudsman office has an advisory board. Maybe there needs to be one for emergency housing services, in the sense where that work is being done constantly, and rather like we meet once a month, right? And we have this system planning once a week, and where there's other people that are doing 24-hour day, night, severe weather, being able to have emergency 911, type interventions. But anyway, I think those are really good questions, and being able to get a little bit more specific, detailed, it doesn't hurt. And to listen to one another is really good, because I'm going to get sure
Oh, unfortunately, Juanita, we just lost you there. At least I did. I don't know if others did as well. Okay, I'm seeing nods that it looks like we're getting some sort of disruption in the signal coming in. Hopefully we'll get you back on here shortly. Any other comment as we go forward? Okay. I would suggest at this point, let me just see something. We are at, well, we're at 3:45. How much more do you have to go? Alexis?
Let's see, I think we have just about, oh gosh, I can't do quick math. Here we go. A couple more pages. I know we can breeze through these quickly and maybe get them wrapped in the next 5 minutes. I will note that the sections 3 to 5 are briefer. It's shorter.
Okay.
So that section might not, right now they're allocated for the same amount of time. But in reality, that section might take less time.
Yes, but am I right? We're at 3:45 now, and we're supposed to wrap up both of those by 4 so that we can get into revisit the measures and metrics. So let's roll and see. And then when I'm sorry, I'm forgetting who's coming in at 4 o'clock, but we'll just punt over to that. Okay.
Not a problem. We also have technically 30 minutes. So starting at 4:30, we have that as flex time as well.
Right.
Great. With that, I'll share my screen again. Apologies and keep it through. And emphasize, so 1.2b describes implementing our phased portfolio reprocurement process, ensuring comprehensive geographic coverage, service continuity, housing-focused resources, and all points of connection in close coordination with our subpopulation-specific providers. AC is modifying program reporting requirements to really support meaningful data collection across the system, including performance outcomes and accounts for full scope and nature of contracted services. Then we have developing standards of best practice to meet the needs of Black, Native, LGBTQIA2 spirit, immigrants and refugees, people living with disabilities, older adults, survivors of gender-based violence, and people exiting incarceration. Then designing youth and young adult programs and policies and practices in partnership with young people to cultivate a strong sense of self-efficacy and belonging. Integration of requirements of healing-centered, strength-based approaches to all KCRHA services and programs. Evaluating program requirements to establish flexibility in funding, establishing a King County Youth Action Board composed of a diverse group of youth and young adults with lived experience of homelessness to ensure that the voices of those most affected are centered in developing solutions. Then we have refining and maintaining through quarterly updates the regional services database, also known as the landscape analysis, which includes all of our homelessness programs in King County to support data-driven planning. That's currently on our website. We then have creating an accurate and live inventory of all publicly funded homelessness and housing shelter projects in the region. Creating
Alexis,
yes.
How is AJ different than A?
So AJ is really referring to looking at. I'm sorry. It happens all the time, actually. So I have a personal vendetta against Alexis. Apologies. Okay, so AJ, creating our accurate and live inventory of all publicly funded homeless and housing projects and projects around the region. And then you were saying, how is that different than 1A, which is real-time bed availability? Is that correct?
Yes.
Okay, so this one specifically, one of the things with real-time bed availability is it really is a focus on specifically like those drop-in type centers that could be accessed theoretically that evening. This one is referring to a number of longer-term programs such as transitional housing and other types of permanent housing. This is something that did come forward from the Community Impact Division, so I could ask to hold until 4, and Owen could speak more to like the specific difference because that's owned by his shop.
Okay.
And then taking us to AL, we have coordinating across providers and systems to provide long-term support for families transitioning from homelessness to permanent housing. AM, supporting outreach coordination efforts in sub-region to encourage alignment, expansion, and effectiveness. AN refers to supporting coordination through KCRHA base building spaces, which are convening between agencies providing diversion services to share information and serve clients more effectively. Support training for community-based or for community members, advocacy groups, and faith-based groups to be more engaged in our shared homelessness response. Initiate, maintain relationships with private landlords, local jurisdictions, business, and philanthropy, coordinating with sub-regional collaborative coalitions and local jurisdictions to develop local support for sub-regional implementation plans. Analyzing region-wide data such as the Understanding Unsheltered Homelessness Project data set with the sub-regional lens to better understand sub-regional differences, identifying and working with people with lived experience in every sub-region to understand the experience of homelessness and how it relates to someone and to where someone lives in King County. Creating opportunities for people with lived experience to give feedback on coordinated entry processes, continuing to pilot Partnership for Zero with integration of improvements to bi-nameless technology, incident command systems, and Medicaid billing, developing capacity and homelessness response system to better leverage entitlement program benefits, and then pursuing additional funding opportunities across federal and state and philanthropic sources to expand services and support homelessness services, providing our local jurisdictions with information to support data-driven decision on regions' homelessness response, including program and investment recommendations. And then the final two for now are coordinate with advocacy organizations to increase state and federal funding into homelessness response. And lastly, incorporate, consider, and implement livable wage requirements in new RFPs and contracts using findings from recent wage equity studies. And with that, I'll stop sharing my screen and turn it over to the chair.
Thank you. And if we got to AZ, I think that means we have 52 of those, if my alphabet is correct. So I think one of the reasons that there is a lot of specifics in this and that there is a lot that is here is that this is essentially a work program that is funded. Because we have a biennial budget, mostly coming from Seattle and King County. And so this is really over the next 2 years what the agency is really focusing on. And I like that it has kind of how it fits into, in that third column, how it fits into making progress on the goal of reducing reducing the number of unsheltered who are on the street. And I think as we talked about this, we knew that we had a lot of detail that we could put into the first 2 years. There's less detail, and in some ways it can be more important detail, which is where are we going to make these efficiencies? Where are the enhancements going? Where potentially we can get more shelter, and how can we get more people sheltered? But this is pretty much a monetarily constrained first 2 years. And really, as you went through that, that's where I was beginning to come to this sort of understanding of why it looks this way. And it is so detailed. I don't know, Alexis, if you'd want to comment on that, or if any of the board members would want to comment. I am not seeing anyone.
I'm just gonna
Go ahead,
sort of,
Simha.
share that. I think the specificity of like the wide array of things that you are talking about in these first couple of years is a real reflection of like the amount of work y'all put in going out and talking to people across the county. Like these, at least as a service provider, this feels like it reflects a lot of the challenges that we face day to day. And so I just wanted to say thank you for going out and actually hearing people.
I think that, did I see it? I thought I saw in the chat that Juanita had to drop off. Paula, did you have something to say?
I do not.
Perfect. Okay. And Ben, I think Ben is now basically able to participate via chat. Is that right? I think that's correct.
John, can I ask one other question to Alexis?
Of course. Yes.
One of the things I liked was that you were talking about sort of the greater connection to entitlement and like making sure people get connected to the resources to which they're available, right? because connecting the government agencies, right? It's hard. It's just hard. And so I'm glad you're reducing that friction. What about like DOL? Is that part of it? Is that somewhere wrapped up in here? Like the ability to help somebody get an ID faster? Holy crap, that would be huge.
Absolutely. Thank you for that question, Board Member Reddy. And yes, I know we've talked as a board about some of the Medicaid strategy pieces that were discussed, but one thing that we've also been identifying is how we can better leverage other types of programs, such as ensuring that folks are enrolled in benefits such as SNAP, helping support any type of DOL programs as well. I think another piece of this is then around for veterans, being able to ensure that vets experiencing homelessness are connected to the resources that are actually they're eligible for, and getting them connected in the right place. Like there are a number of ways that we can better leverage programs and funding that exist and is available to folks that may be experiencing homelessness by being really more efficient and coordinated and aware of how we can make those connections and get folks again connected so they are able to enroll and receive those benefits.
Okay. So we have just a couple of minutes here before we get to 4 o'clock. Do you want to start in on years 3 through 5? Or do we want to maybe just take a 5-minute break and come back with, I guess it's Owen who's going to be joining us, right? Yeah. Board, how do you feel? Or how?
I'm fine to keep going.
Okay. I'm good either way. All right, I'm going to keep on going.
I'm muted, apologies. Taking us to years 3 to 5, this begins on page 36. With that, we have 3 columns within this table. Again, looking towards the future. And we did model this table, again, assuming that there are no increases to program or administrative budget at KCRHA in the next biennium. Did not want to overplan for the future. We can't predict the future, so wanted to make some conservative estimates just around what we would include. So you'll notice that a number of these initiatives fall within this category of having them years 3 to 5 because perhaps they have a predecessor activity, so something that needs to be done in years 1 to 2 in order to make it happen in 3 and 5, or it's something that had not been identified as like high priority, but it's something we've identified that definitely needs to be done in the next couple of years. And so I'll breeze through these actions. This table is not as lengthy as the first table. And so taking us to 3-5A, we have developed by name lists for each household type, family, single adult, and young adults. And then we have partnered with technology leaders and developers to create a platform that allows for participants to see and interact with their data. Consolidating all severe weather response functions for those living unsheltered to support a centralized response, and really having true standardization across the region. And then pursuing sub-regional agreements with our sub-regions to look at pooling, how we can pool funding for homelessness services, expanding funding support to implement evidence-based strategies and programs that serve families, and then in partnership with organizations surveying historically marginalized communities, developing an inventory of successful approaches and best practices for other programs to integrate, developing qualitative, quantitative evaluation tools to understand how these approaches may work for historically marginalized communities, developing pathways for immigrants, refugees, asylum seekers that consider the varying levels of eligibility and documentation requirements, changing the eligibility requirements for diversion resources to allow for those at risk of homelessness to access diversion services rather than exclusively right now as it stands for people just currently experiencing homelessness, increasing provider access to diversion training to ensure best practices are followed, removing 30-day to 45-day time limits to complete diversion training and accommodate households with complex needs, then work with diversion providers to include case management to support for 3 to 6 months after financial assistance is provided, review existing region-wide data collection practices with a racially equitable lens, developing inquiry and evaluation methods rooted in innovative evidence-based methodology to inform performance measurement practices, developing and implementing culturally responsive service provision audit framework for all disproportionately impacted populations, working with technology developers to create and deploy a platform that allows for direct client feedback from KCRHA independent of a provider or a surveyor, and ensuring that it is accessible and easy to use, having continuous improvement mechanisms, connecting that platform with other systems of care, and identifying ways to manage information on supportive services such as case management openings or availability of clinical supports for other systems. Develop processes to ensure units in the region are filled through coordinated entry, implementing effective coordinated entry compliance mechanisms for all housing programs in continuum of care, establishing a data connection between homelessness system and school districts to improve reporting and prevention, identifying and supporting implementation of clear policy and programming strategies to engage families identified as experiencing homelessness by schools and support them with necessary supports. Aligning our strategies, aligning KCRHA strategies focused on children and youth with King County's Best Starts for Kids best practices, then partnering with hospitals and medical facilities to improve connections with pediatric clinical staff for greater levels of support and connection for families, and then strengthen coordination between providers and other systems through collaborative convenings. And then our last one is creating strong connections with child welfare systems to create proactive connections for youth exiting foster care or other youth program settings.
Okay, okay, I'm off mute. Any questions or comments on the 3 through 5 year plans from the board? Simha or Paula? I know Ben said,
Nope.
Okay, Paula?
No, I have no questions.
Okay.
John, I was just gonna say,
Yeah.
It's a huge body of work. Like,
Right.
this is a lot. It's a lot, and I'm glad we're laying it all out there. No particularly wise comment. Just wanted to share that's a hard road
Well,
ahead.
I think that as we look at this, this was a somewhat financially restrained look, if I understand correctly. There might be a little bit, we're looking at this from sort of the status quo moving forward. And I guess one of the questions that I would have is, what are the major changes from status quo going forward that we would request? Looking at the plan, what does it tell us about how we need to change our strategy for seeking funding from the two governments that primarily fund us, and from the state and federal funders? I mean, I think that that's a question that you have to ask. If you just say, well, it's going to be the status quo, then we're going to argue to our funders that it be the status quo. But if the status quo won't make, and I shouldn't say status quo, because there's a lot of effort in here to make things more effective and efficient. So I guess Alexis is, as I always say, the budget is your biggest policy that you adopt. So how would we use this to change or modify what we go to King County, Seattle, and as the other areas of the region come on to buy into this plan, if it's the North County, East County, Southeast, Southwest County, how do we do that to ask those folks how to weigh in on this? And to Ben's question, how do we get X hundred or thousand more shelter beds with service? And maybe I'm just asking more of a rhetorical question and saying that's the, to me, that's what we should be doing with this exercise. Okay. Well, that went
Fantastic.
over well.
No, I can respond a little bit to that.
Okay.
And also noticing apologies that Owen has joined us. I
And
think in
Owen,
many
yeah.
ways, I know in one of the memos that we provided to you all in April, also which was an initial identification of these strategies for years 1 to 2, 3 to 5, and we identified some go-for strategies for funding. Part of that was to really set the stage to say, should new funding become available, these are areas we would want to put funding towards. And that having that as a part of the plan, I think we've tried to be responsive to a lot of the feedback around wanting to ensure that we're creating a plan that's that we can implement and is realistic, while also doing our part to create more efficiency in the system, make sure that things are functioning as they are. And there's some major restructuring things that are included in this plan. And truly by how we view it, by having the board weigh in and really approve this plan is in many ways giving us a green light to further KCRHA, a green light to further pursue and develop these implementation plans. There's a number of these that will need to be project planned out, and some, as we've mentioned, for years 1 and 2 are already underway. But we view this plan as the board giving us the green light to further pursue and move in partnership and develop these specific project plans to keep the ball rolling, and have dialed back some of the identification of, what, being directive to what we want to pursue. And so by including now in the plan kind of these go-first strategies for funding, just making it clear, like, here's what we can do with what we've got, and assuming that nothing dramatically changes, here's still things that KCRHA can do to create more efficiency in the system, build stronger partnership, better serve folks in a more holistic way that we anticipate will also improve their own housing outcomes. And with that, still keeping an eye towards the need to scale temporary housing options to bring more folks inside. And we've identified some of the areas in which we would invest funding in order to do just that in the plan. I don't know if that fully answered your question. And I think there's some pieces here also around that we are looking for policy direction from this board on,
Right.
How we do move forward in doing that. But that's what I would share in response.
Okay, before we get to Owen, Simha, you have your hand up.
Thanks, John, and thanks, Alexis, for going through that with us. I guess one of the things on my mind is, because it's so many things, like so many items that feel separate, it can feel hard to sort of think about what does this look like altogether, right? So if you were to imagine like current state and future state, right? Like somebody experiencing homelessness and maybe a frontline service provider now and 2 years from now, what would that feel like, right? Like 2 years from now, ideally, you call 211 or you show up to that frontline service provider and they can say, hey, we've actually got a bed for you at blank place. Just go, they're holding it for you. And when you show up, you know that the staff has been like, has had some culturally specific training or like trauma-informed care. So you're welcomed, right? You're treated well when you arrive. And then you, like, maybe turns out a year prior you'd had a case manager and they can look that up and figure out where things stand. And you can look up your own data potentially and realize like, oh, they've had the wrong phone number. They've been trying to reach me about a permanent supportive housing unit. It's like imagining what that feels like from the end user state, I think would be helpful to me. And like when you envision it, I guess. Not necessarily written out, but just, what are the things that are most exciting to you when you look through this and what works?
For my opinion.
Mm-hmm.
I think the piece, and actually I would invite my colleagues again, I hope it isn't clear this isn't an Alexis plan, but this is really representative of, I'm laughing at my colleague. This is representative of the wide expertise across KCRHA. I know you only see my face once a week on this, but a lot of our staff spent a tremendous amount of time and come with an abundance of experience, both frontline and also in data systems about, you know, that have been informing the key pieces of this plan. And so I actually would love to invite some of my colleagues to speak on this piece. And I know I want to be mindful, we have Owen on the line now, we have 30 minutes to talk with him about data. So maybe, Owen, maybe a good segue into this. Could you speak a little bit around the vision of how some of the innovative things we're doing around data could really be improving somebody's experience as they are navigating through the system?
Yeah, happy to. Hey everyone.
Hi.
For folks who don't know me, my name's Owen Kafis. I use he, him pronouns. I'm Chief Community Impact Officer at the RHA. I think I know most of you on the panel, but for those who are attending, there's some things I'm super excited about in this plan that, like, I think are not the headlining, this is the thing that the RHA is doing. One of the really key pieces is leveraging the experience of our data asset manager, Janelle Rothpoke, who is truly fantastic. She's our HMIS administrator and has been involved in the system for a long time. But she's really pushing our use of our Clarity platform, which is our HMIS, to be as useful as possible. There's one major, really not sexy initiative that is actually going to be pretty transformative to the way that we do work in the system from a data standpoint, which is getting us to a real-time bed and unit inventory and vacancies. So right now in our system, as many of you know, we are looking at utilization across our system on a regular basis, but at any given moment, we don't necessarily know where is there a bed available for somebody to go right now. This initiative, which is already underway, is figuring out how do we do that well within the system that we're already using, so it's not adding additional systems for folks to use, and how do we do it in such a way that when we're looking at beds and units, we're identifying the things that are most important for folks to know, both from the people doing the referral to a bed and also the person who may be going to that location. So deeply excited about that. It's a lot right now. It is a lot of very dry, nerdy conversations about how we implement that in a database and from a user perspective, but very excited to see where that's going to get us. Now, we'll say that I think in parts of the plan where we're talking about timeline, this is something we're starting this year and hoping for implementation next year. So early 2024 is when we're looking at implementing this. And right now, yeah, I think I could go on about the things I'm excited, honestly about the things I'm excited about, but just that fundamental piece, I'm so thrilled about, and it really touches on what you were talking about, Simha, somebody calls 211 and the folks on the line have to rely on the relationships that they have and know-how of maybe this shelter has a space for somebody, maybe we can get you into coordinated entry this way. And it's really about how do we better liberate the information that we all know about the system so it's not so dependent on person to person. Cool. I got really excited about that and now don't remember what I was here to talk about other than data.
So I think we were supposed to be looking at the measurements and metrics that are going to be used within the plan, right? So that's what I'd like to get, again, how we're going to do that, what we're going to learn from it. And then if we have at least a few minutes for questions, that would be excellent.
Awesome.
So, okay. Owen, do you want to launch into that, or is that what you were expecting to talk about?
It is what I was expecting. One of the things that to talk about. Let me just, would it be helpful if I shared?
Yes.
Okay. Screen, I've gotten so used to Google that doing this here is a little strange. Okay. I think I found the right way to do it. Are you all seeing a draft of we have one overall goal?
I am. I think, yep, I'm seeing Paula and I'm seeing thumbs up going through. So I think we're good to go.
Thank you. I appreciate it. So one of the major changes from the previous version of the 5-year plan to this version is a true simplification of what we're looking at for measuring success against our goal. In the previous version, we were looking at how do we measure the success of each individual key action. And here what we did is instead took some time, took a step back to try to figure out what are those key actions actually driving toward, and what are those high level metrics that we need to be measuring to know if we're moving in the right direction, with a clear understanding of how each of those metrics may affect one of these pieces. So the major measures that we're looking for, we boiled it down to 6, all of which can be sliced and diced in a huge number of ways. But with our goal of bringing more people inside, we really started with looking at how many people are accessing the homeless response system. So on our website right now, you can actually see the total amount of people who are being served or accessing the homeless response system on a monthly basis. We publish that information. And what we will see when we expand the system, and anytime we're adding additional beds, units, shelters, we're going to see that number likely go up for a period of time. We know that there are too many people not touching the system because we do not have enough resources. So we're going to be looking at how many people overall are accessing the homeless response system on a regular basis. A key part to that, which is looking at it from a slightly different lens, is how many people are entering the homeless response system. So as we scale resources, is that going to more people? How many folks are actually entering that system? We can look at this both for the first time that somebody or a household is entering the homeless response system, and if they have a previous record in HMIS in the past, we can also look to see if this is a return into homelessness or not. Of course, we're going to continue to measure exiting the permanent housing. It's really key for our system in order to bring folks inside, not just to have more places for them to go, but use our resources more efficiently. And so we're looking at how are people moving through the system, how are folks exiting, with of course always keeping an eye towards the ultimate goal of everybody moving towards permanent housing. A few additional components that we're looking at is returning to homelessness. So the HUD standards are 6, 12, and 24 months in terms of measurements that we look at for returns to homelessness. Those are items, again, that you can see currently on some different dashboards on our website. And then, of course, with that overarching goal of knowing that we need to increase the number of temporary and permanent housing units across the system, we'll be regularly measuring against that. The thing that's exciting about what I was just talking about previously about the bed and unit inventory is that's going to allow us to have a more precise view of that over time. I could go into a long conversation about the housing inventory count, but I won't right now. If you want to know more about the housing inventory count, happy to talk about that. But this would be a measure of units in the system that are HMIS participating. And just want to make that clear. And that's a pretty good proxy of what we're seeing across the system. And then one of the pieces that we're looking at here is the introduction of kind of a newer metric in terms of system performance, which is throughput. So we're looking at throughput of temporary and permanent housing units in the system. What you'll see on our website, and what is still something we will continue to report on, is length of stay. So how long are people staying in particular interventions? But what we've heard from the board and from other members when we're thinking of, again, any kind of efficiency standpoint, we're looking at how many people can a particular unit serve over a period of time. So this throughput is talking about a time basis of how often people are moving through a particular unit. The bed and unit inventory stuff that we're doing will actually help us do that better. Again, one of the reasons I'm really excited about it. But these are really our overall 6 metrics that we're going to be looking for and be pulling together. Again, some of these are things that we're measuring already. It's just not quite as clear that they're under this umbrella of this goal. And some of them are going to be new, like the throughput to temporary and permanent housing. The key piece here is, of course, as we are looking for equity in our system, we have to slice and dice this information in a number of different ways. So we'll do it by race and ethnicity. We'll look at different household types. We know that within our larger system, there's actually a few subsystems around families, single adults, and youth and young adults. And then be looking at this by the program type. So what you'll notice under that program type is we have emergency shelter / housing there in one bucket. As we increase the number of temporary housing locations in our system. And as we get to a better understanding of how we tag those under different types of shelter pursuant to what we learned in our modeling and research with folks living unsheltered, we'll start to be able to break out performance by all of those different subtypes as well, including things like tiny home villages, and if we're able to get to scale in anything related to like medical recuperation. So that's what we have written in this plan. One of the things before opening for questions that I want to just assure people about is this doesn't mean these are the only things that the agency is measuring. There's a lot of things we have to do on a regular basis for HUD, for commerce at the state level, and a lot of things that we think are important to know about our system that are beyond this, including things like the efficiency of our coordinated entry system, how people are moving through that. So this is not an exhaustive list of what the RHA will be continuing to measure. This is really just a focused way of saying, are we moving in the right direction on the goal that we have set out to in this 5-year plan? And with that, I'll open for questions.
Thanks. I'm gonna in the chat right now, I'm going to ask a question from Ben, and then there is a Daryl Garner who has also asked a question. So if you could look at, I don't know if you have access to the chat, it may be easier, but Ben says, are there any measures we have available that are proxies for the number of unsheltered people? And then his second question, is there a plan to add targets to any of these metrics?
Yeah, thank you. I was not looking at chat, so I appreciate that. That first question, are there any measures we have available that are proxies for the number of unsheltered people? Measuring unsheltered homelessness is difficult, and that is why Ben is adding in proxies. Like, just want to be really clear for people, we do not measure unsheltered homelessness very well. We're trying as an agency to get better at doing that, and trying new and novel ways to do it. Right now, we do have a way of understanding within our system, within HMIS, of people who are touching services, whether that be outreach services, day shelter, or other parts of our system like coordinated entry, maybe the one point that people are touching. We do have some coding that we have in there in order to show how many people are living unsheltered. As we scale our outreach, street outreach work, we'll be able to have a better understanding of that. But right now, Ben, without larger efforts like things like versions of the point in time count or doing system level modeling, we don't actually have a very good understanding of how many people are sleeping outside on any given night.
All right. Yeah, yes.
Sorry, go ahead. If people have follow-ups on that, happy to take them before going to the next question.
Is there any follow?
Owen, how in that system modeling piece, how far can you get when you know the number of people passing through a system and know the amount of time that they have spent homeless, in terms of modeling how many people are homeless on any given night, and then subtracting the number of like occupied beds on a given night, if that makes sense. Yes. Like, can you use length of homelessness per episodes to help get you there, just as modeling approach?
Yeah, there's a couple things that we look at for modeling. Length of stay is not actually one of them. Because homelessness affects people so differently and looks so differently for people, it's hard to kind of fit a length of stay or episode to, even if we break that down by characteristics of individual households, really hard to use that as a proxy for about how long we think people would be experiencing homelessness to get an understanding of what unsheltered might look like. The things we do look at, and what our modeling that is included in this plan does, is it goes well beyond the information in the HMIS, including a number of other state level systems that have indicators of homelessness, but not touching the homelessness response system. A lot of that helps to indicate how many folks we are not including in HMIS who are likely living outside. One of those indicators, for instance, is in Medicaid claims not having an address, for instance. Now it's not a perfect match to that, but it does help us to a better understanding of the full universe of people experiencing homelessness.
Paula,
Excellent. Ben had another
any
question.
follow-up? Okay, hang on a second. I was trying to see here. Did we cover everything?
That was just one of his questions. I have other parts.
Yeah, I think it was additionally, okay, targets you covered.
I didn't cover targets. I can be more explicit.
Oh, okay. All right. If you could.
So we don't have targets set out in this at the moment, Ben. There is a need to develop some of these targets. One of the key things for us to do is really baseline on these metrics, particularly the newer metrics like throughput, and then be building towards having those targets. We do technically, as a COC, have system performance targets currently. And you can view a little bit more of what that looks like on the system performance dashboard on our website. Those were set, I think, back in 2016. And really focused on 5 system performance metrics that are aligned with HUD system performance metrics. So exit to permanent housing, move-ins from literal homelessness, utilization, returns, and length of stay. And there are targets broken down by individual program types and population. And that's what's reflected on our website right now. A lot of work went into getting to those targets. And so one of the things we're trying to do, particularly as we move towards something like rebid, is figuring out really what those targets need to be. Now, one of these obviously does have a target associated with it loosely, which is gating units in the system. And we have a way to start from there, but we do need to be able to get some trend information around these in order to actually build towards those targets. To your point about utilization, oh yeah, critically important. Our utilization rate is critically important as we're looking at. And so what I was saying is we're not looking at, we're not limiting what we're looking at to just these. We'll continue to have information on our website, particularly around the 5 system performance measures I just talked about. And that does include utilization broken down by housing type. So that would include emergency shelter.
Okay, and there was another question from an audience member in the chat, Darren Gaynor, I believe is the name. Are there reservation systems similar to what hotel industry uses that could be used to integrate and leverage HMIS, HIC data for real-time housing shelter placement? And I'm not 100% positive if you're prepared to answer that question or the right person to answer it, but I'll leave that open at the moment.
Yeah, I'm happy to give a brief answer to that. Aaron, thanks for that question. There are some systems that different COCs have used around more of a reservation model for these. What our approach is, in order to allow for more of a referral-based system where we're finding locations and appropriate placements for folks, we're getting to something that's actually similar, but not exactly a reservation system, so that we are making referrals to locations and then the location is able to pick up that referral. So the real-time bed and unit inventory thing I was talking about earlier helps us get in a step much closer to a system like this, but is not exactly parallel to a reservation system.
So let me ask a crazy question related to that. If there were a reservation system, and I believe what you're looking at here is I can go online and make a reservation to stay somewhere for a week or whatever. If that is not going through a central area like KCRHA, are we losing a data link if it's being done separately?
Potentially, yeah. And so we're not looking, well, I will just say as a person who oversees data, I really don't want to spin up any systems where we would lose access to data.
Right.
I want to know more. But I think what Darren's asking here is like, is there an integration component that would allow us to better leverage the information we're collecting and use? One of the real issues with the reservation system and in what you were just talking about is that we do have some contractual obligations with money that come to us about the referral pathways into shelter beds. An example of that is Hope Team Set Aside Beds make up a large number of our shelter systems here in Seattle. And the referral system allows that to be maintained. So allowing not somebody to directly put in their, like just, there's a vacancy, I as Owen will sign myself up for that vacancy and go. It instead maintains those referral pathways that allows for some prioritization of people into those units. And while we maintain a scarce system of unit availability, that need is likely going to maintain.
Okay. Thanks for that. Paula, did you want to weigh in and have any question or comment here? I'll see if she's coming back on. Simha, you just raised your hand, so I'll let you go.
Just in sort of the general data category, one of the goals was to create a community participatory research program in years 1 to 2. That is super hard to do well. Are you going to try to own that work in this first year, or work with outside folks like academics or others?
First, I want to really appreciate the fact that you have questions about community-based participatory research. And a recognition that it's difficult. We're in swing of continuing to build on that right now. So a deep part of how we did the modeling around the shelter and housing types was actually working with folks with lived experience as coders, training them up as researchers. Members of my team have continued working with that cohort of folks in order to get to a full research design from the very beginning all the way through. That takes a lot of time. We're not going to see results from that for a minute. Maybe a couple minutes, but we are deeply dedicated to making sure that as we do research and look to addressing real problems within this community and answering questions that we don't actually have answers for yet, to do that hand in hand with community. And just loved that I get to say this publicly. I'm so proud of my team for continuing to push for that. And I think it's one of the ways that we really do center the voices of people with lived experience in the full work that we do.
Thanks, Owen.
Okay, again, Paula, do you have a question or a comment on this?
I do not.
Okay, thank you. All right. Owen, thanks very much for coming in and giving the explanation today and going over some of the data material that we're looking at collecting and how it can be used. So appreciate that.
Of course. Can I make one small plug real quick, John?
Oh, no, not at all. Of course, please go ahead.
Thank you. One of the things I want to say with this is, like I mentioned, we're measuring some of these things already in our system, and they're in disparate various parts of kind of our ecosystem. We're working right now on setting up a more streamlined process to get to really repeatable structures of data. Again, not the super sexy stuff. I have a data engineer who's working with us in order to help us transform data as it comes out of HMIS to help replace an aging analytic system that King County DCHS has been holding for a long time. And it's amazing that they were able to hold it for as long as they did. But it's going to take, I say this all to say, it's going to take a minute after this plan gets passed before I actually have public facing dashboards to report on this. I just want to be really clear with folks on that. Some of the reporting on this will be a little bit ad hoc for a moment, but we will get to a point where we have public facing dashboards with all of these figures for folks to look at regularly.
Okay, and for any public who are with us, Owen, where can they get access to this information and some of the data on our website?
Yep, it is kcrha.org/data, but I will put a link in the chat for folks in just a moment.
That'd be super. Thank you so much. Thanks for being with us. Any other further questions? Okay, I'm not seeing any. Alexis, we're basically at this point at kind of just a wrap up. We're 4:33, so actually we're directly on time, but I'm not quite sure we have a half hour of wrap up to do. So what things are you looking for from the board members who are here? And then if Austin is still on, maybe he can give us a brief update. on things that we should be looking for and to let the public know what public meetings are coming up.
Sounds great. Thank you so much. With that, I think I'll just provide a quick note on what you can expect for your meeting next week and as it relates to the 5-year plan, and then I'll invite Austin to speak more about upcoming meetings. So again, for your meeting on the 10th next week, as it relates to the 5-year plan, we'll be doing a quick overview. I believe Mark will be co-presenting with me about the elements of the plan. Also within your meeting material packets will include a memo and a summary of some of the key issues that have been raised within this subcommittee. And the crux of the discussion for the full board is some of these matters related, like the policy matters of the plan. Again, we as staff are looking for policy direction from you all as a part of the plan for some of these key areas. And so wanting to bring kind of a report out of the conversations and issues that have been raised here in this subcommittee to put before the full board. With that, I'll turn it over to Austin to speak more on upcoming meetings.
Yeah, so as Alexis mentioned, we have a upcoming meeting on May 10th. That will be the regular meeting of the implementation board. There's going to be a lot of things to talk about, including the 5-year plan. And then we're going to have another meeting on the 16th. That's going to be the budget meeting, the budget committee meeting. We're going to be open to the public, and that's where we're going to be discussing contracts and stuff more in depth and have more of a Q&A as members want to learn more about that. And then on the 19th of May is when we are going to be having the IB vote on the 5-year plan in a special meeting session. So that's kind of the overview of what the IB has from a top down. So. Yeah.
Okay, and I know we've had a situation with not having full membership from the LEC.
Yeah.
That I understand now is almost or has been solved, and could you give us an update there?
Yeah, so the full members, so the people with lived experience represents 3 members on the implementation board. We had 2 of the 3, which would be Rankin and Spotted Elk. And then Brandon was already confirmed by the GC, but never got the official nomination from the AC. And then yesterday, the official nomination came in. So Okisha Brandon is fully seated. So we have all 3 seats filled out. And then we also have 2 alternates, but Zaja is also the only confirmed full alternate. And if the bylaws pass, Zaja could fill in for any of the 3 lived experience that's needed, because the alternates will now act as a slate and not necessarily directed to one. So
okay, so good to know that I know that there were some concerns that, you know, I'm not quite sure which meeting it was, but we've had a few of them that had not been resolved. So I'm happy that has been resolved. Any other issues that board members would like to bring up, or anything that staff would like to?
Yeah, Austin, you said there's a budget meeting that's public?
yeah, so on the 16th we are going to have, there's a time that's always dedicated to the budget meeting. However, they don't always meet, but we're going to open it up to the public as well. So we have all members drop in. This is specific to the contract questions that have been getting asked and contract handling and like what the process is and all that stuff. So it's mostly we're using the time that was dedicated for the budget meeting for the contract discussion. Since the budget's already going through the motions, there really isn't any like budget discussions. However, this contract discussion falls pretty hand in hand with it.
Did the invite come out? Because I don't see it on the calendar.
It should have been. I will double check and follow up after this meeting just to make sure, but it definitely should have been.
I had not seen it. The last budget one I had was for the 2nd.
Okay, I will make sure that gets to you guys tonight.
and could we make sure that the link comes out? I mean, the one for the 2nd came out the morning of the 2nd for the afternoon of the 2nd, although there may have been one that I missed prior to that. And so that makes it pretty tough to join in. So if we can make sure that we have that, and then the right link is sent out just prior to the meeting like we did today, I think that really helps us all connect in.
Yeah, absolutely. I'll make sure that gets done.
And-
And then just flagging, I'm going to be out of office tomorrow, except for the drop-in session at 1 to 1:30 to discuss more in detail for any board members that are here or not here about the agenda for the May 10th meeting. And
Okay, perfect. Any, Alexis, do you have anything?
I think just as a reminder, you all are slated as the implementation board to take a vote to approve the 5-year plan as part of your special meeting on the 19th. The governing committee is slated to vote the 1st of June,
Right.
the final stretch.
Okay.
I want to correct the record
yes.
really quick. I
Okay.
got the 19th and the 16th meeting mixed up. So you have the 19th invites. You don't have the 16th invites. I'm going to be sending the 16th one right now. I
Okay.
apologize greatly for that.
No, that makes sense. And we're beginning to get enough meetings that it's even hard, that's hard to keep track of it in our inboxes, at least for me. That may be a function of age. Anything else to come before us today? Any other comments? Again, thanks. I do want to thank Paula and Simha, also Ben, Christopher, Juanita, and frankly, Okisha, who have been pretty regular attendees at this meeting, so that we're able to keep this this process going. It really helps staff, I think, be abreast of what at least some members of the IB are thinking about. It gives an opportunity to get some of the strong detail out to the public, and I think all of those things are good things. And then I do think we just all need to be prepared for a pretty important meeting on the 10th. And I'm hoping to get these dates right. And then that final vote on the 19th. So appreciate all of the work. Is there any objection to us adjourning the meeting? I am seeing none, so I will declare the meeting adjourned. Thank you again for all of your participation, and thank the public for your participation in being here. Good night, all.